Hello, everybody, and welcome to this episode of Weight Loss Information. And we're continuing with our GLP-1 series because as I spoke with Katie Chapman, the landscape in weight loss has changed dramatically in the last year and a half or so. And GLP-1s are misunderstood. There's a lot of misinformation out there. And today I have a guest that probably all of you are familiar with, but we'll let her introduce herself in just a minute. But I've asked Kellie to join me today because she has experience as a patient who's had both bariatric surgery and has used GLP-1 medications. So I want to get her experience with that. And she's also very active in the community. So hears from a lot of other people. So welcome, Kellie. So reintroduce yourself to the community, and I'm sure everybody knows who you are from your past adventures, but we'll talk about your new ones as well.
Yeah. So I'm Kellie Wilson. I had surgery 6 years ago at this point. I have been on and off GLP-1s since they started hitting the market. So I think about 2 years now, 2.5 years. I think in September it'll be 3 years.
Okay.
So that's a little insane to think about how long I've gone back and forth. Um, my handle on Instagram is Berry Branded. And I run a boutique firm that helps with the back end of tasks with people in the bariatric community, the wellness and health field. Because many of you probably know that I started a podcast with a friend of mine 5 years ago.
During the
And I
pandemic, right?
Yeah, during the pandemic. Yeah, it
Yeah.
was right when everything shut down was when it
Yes.
went live. And I have recently left, and so I kinda started my own thing, but I absolutely love the bariatric community. I absolutely love the people in it and hearing the stories and sharing real life and what actually happens in life behind the camera. Um, and so, yeah, I'm still here
Behind the camera.
behind the camera. That's the thing that I feel is such a misconception in the bariatric community is that everything that's shown in the camera is actually real.
Um,
And it's one of those things, like, I saw a reel the other day, and it was, showing, like, "Oh, this is what the remodel looks like," and it was, like, all pretty and everything was pristine and put in its place, and it said, "This is what real life is," and it flips the camera,
I
and it's,
love
like, boxes and tarps and all of this stuff, like, just shoved in there, and it was not pretty. It was not aesthetically there. And that is exactly what social media does. It shows you the pretty, the highlight reel, and that you're doing amazing and you're losing weight and you're just everything's perfect. And in reality, most of us are far from perfect.
right.
Uh,
Our lives are lives, and life is freaking messy.
yeah, 150%.
Yeah.
Life is a messy, messy thing. And
And
so is a bariatric journey. So is a GLP-1 journey.
right. So
They're
is a
all
relationship. So is,
Yep.
life is messy and it's difficult. And so my podcast, as you know, focuses on how do we deal beyond bariatrics
Mhm,
with bariatrics as well. So I'll
mhm.
talk about psychological topics. And as you and I were talking right before we started the episode, we all know what we want to do and what we need to do. That's
Yep,
not a surprise to anybody who's lived in diet world for years and years and decades.
yep.
But there are things that get in the way of us doing what we know to do and actually what we do. And so if we can identify some of those obstacles, then
Mhm.
we can work on those. And for some people, beginning with understanding and accepting that obesity is a disease is
Yep.
one of those obstacles. I don't want to believe I have a disease. I don't want to believe that whatever it happens to be. For me, it was, I don't want to believe I'm an addict,
Oh, yeah.
but coming to terms with that and accepting that really was the gateway for me to
Mhm,
begin working on that.
mhm.
So let's start with talking about the reality that obesity is a disease, and how did you come to that awareness?
I didn't honestly realize that obesity was a disease until the podcast, and
Ah,
would have guests on that would talk about obesity as a disease, and that at that point it was not widely known as a disease. It
true.
Those conversations were just starting to come across, and I think when I realized that it was a disease, I think it was easier for me to grasp it because I already have diseases.
Right.
Because of the 4 autoimmune diseases, I'm already used to being like, "Cool, let's just add another one on." Uh, and so I think it was easier for me to realize like, "Oh, yeah, it is a disease.
Right.
It's in my system no matter what."
I think for some people, I mean, there's a fine line with this disease concept. Now, I fully, wholeheartedly believe that obesity is a disease, and it's a disease that's going to be pushing against you for the rest of your life. The good thing about the whole world understanding or coming to understand that obesity is a disease is it
Mhm.
takes a lot like, oh my God, it's not a moral failing. I'm not a loser. It's a relief, and that's
Yeah.
exactly what it was like for me when I was like, "Oh my god, I am an addict." It helps me make so much sense out of so many
Mhm.
things. So, on one hand, it was a huge relief. The danger is that people can potentially use that as an excuse. I have a sister who was living in a low income apartment complex and she needed to live there because of her finances. It was a no smoking complex. She smokes like a chain smoker. I'm like, what
Mhm.
are you doing? Trying to get yourself kicked out? And her excuse was, well, I'm an addict. What do you want me to do? I'm like, ah.
Yeah.
So I have a disease is not an excuse not to do the work to treat the disease.
Mhm. Yeah, for sure. I think, that follows along with exactly where I was, even 6 months ago where I was like, "Well, I'm not feeling good, so I can't go out and walk. Oh,
Um,
my body hurts, so I'm just gonna lay down." It was,
mhm.
yes, it was true,
Yes,
but then it was something like, "Well, you can take 10 minutes and walk around the block and move
right.
your body, or you can get up and make dinner instead of ordering it."
I love that.
And that's a hard thing for
It
somebody
is.
with
It
autoimmune disease
is.
where it affects your actual body.
So I'm glad you mentioned that because there are realities and there are excuses. And where do
Mhm,
you draw that line? Because the
mhm,
disease is a reality. And there may be days when, because of the numerous diseases you have, it truly is not a
mhm.
possibility or an option for you. There are probably other days where it would be easy to say, "I can't do this," but what
Yep.
I'm impressed by is you're like, "Well, let me try it. Let me get up and walk around the block for 10 minutes. If it makes me feel better, maybe I'll keep going. If I'm done in, I'm not gonna do it." So it's
Mhm,
finding and accepting for all of us. There are realities, you
mhm,
know, that are not excuses, and there are
mhm.
also excuses. So having somebody outside of yourself sometimes to encourage you or help you work through those, but also trusting your own body.
Yeah, yeah, I think so. I have a friend, Katie, and she is constantly like, "Kelly, you can get up and walk for 10 minutes." Like, she's a very real person that is going to tell you exactly what she's thinking, which
Mhm,
I appreciate. I do appreciate it. She's also had bariatric surgery. So, she gets that, yeah, bariatric surgery is hard. She had regain, and she
mhm.
fought tooth and nail to get rid of the regain, but this girl, she inspires me so much because not only does she work out, you know, 95% of the time, every single morning, she gets up at 4 o'clock,
Oh
works out
my.
before she goes to work. She meal plans and preps every single Sunday. She goes on routine. She is like not the perfect, but she's a good inspiration. to
Yeah.
have. It's like, if Katie can do this, I can do this.
That is a great way to look at that. And, even Katie, who is doing it, if you can do it 85, 90, 95%, you're doing remarkably well. And to have
Mhm.
somebody like that who, A, is kind of a role model, and B, is willing to kick you in the butt,
Mhm.
when you need it. And you're strong enough too to say, no, today I cannot get up and
Mhm.
walk 10 minutes. Or,
Yep,
okay, fine, let me give it a go.
yep.
So, the reality of that. And you said something else in there, regain.
Mm.
Speaking of realities,
Yep.
for almost everybody who loses weight through bariatric surgery, there's going to come a time when there is some regain. Yes or no?
Yeah, oh, yeah. Yep. Even if it's like 5, 10 pounds, even if it's, like me, I gained back 60. Um,
Mm-hmm.
there's always going to be a little bit or a lot of regain. And
Right.
shared about it. I actually shared a post 2 days ago where it was, how many months did it take you to lose the weight? And I went from 2019 before I had surgery, and I did a photo of every single year since then.
Nice.
And when it came to like the last 3 years, 4 years, something like that, I was up 60 pounds. Then I lost 50 pounds. And then I was up
Mm-hmm.
40 pounds. Now I'm up 50 pounds. And that's where I ended it, because I am in the
Mm-hmm.
middle of trying to lose regain and trying to flip the switch in my brain, trying my hardest, my damnedest to lose some weight. And
Right.
there are some things which I didn't know when the first time I lost it with the GLP-1, which I'm sure we'll go into, is I am now postmenopause at 39.
Oh, man. Wow.
Ye So I have 4 autoimmune diseases.
Mm-hmm.
I am postmenopause. I
Oh,
am
gosh.
ADHD, and I just there's it's a shitstorm over here. That's
Right.
exactly what it is. Trying to
That-
lose weight with all of that is a shitstorm.
exactly. And just like the disease of obesity itself, where there are so many factors that come together like a puzzle, and you're my puzzle friend. You love to
Yeah,
do the puzzles, but it's not one thing.
nope.
Behaviors are part of it, genetics are part of it, other medical issues are part of it, medications are part of it, menopause is part. There are so many factors that come together and work against your
Mm,
efforts
yep,
to maintain weight. Now,
yep,
first thing is, okay, so we're dealing with the disease and we're going to figure out what sort of interventions we're going to use.
mhm.
Regardless of the intervention, and we're going to end with this, but I'm going to stick it in here too, is you have to be doing your part, right?
Oh,
The
yeah.
behavioral things. And
Mhm,
so when you slack off on that, you might have some
mhm,
regain that's related to the behaviors. But you also have to be real with yourself and have compassion that you
mhm.
have these other factors. And so, again, when people get super hard on themselves, we've got to look at the big picture. Are you
Yep,
doing your part? Well, yes, I am. Then let's look at some of these other things and what are some interventions to treat those. Now, if you're not doing your behavioral kind of thing, we need to get that going first.
yep,
And then let's see how is your body responding to that and how is it not. So when
yeah,
we're looking for obstacles between what I know what to do and what I'm doing, we have to identify what those things are. And you and I were talking just a minute ago about
mhm.
attention deficit disorder.
Yeah,
Let's go there for just a minute before we go to the GLPs.
okay,
And I was sharing with you that I have a friend whose husband is a physician who works with just ADD, ADHD. And we were having a conversation, and he told me that the number one comorbidity of untreated, and in
mhm.
many cases, as you said, unmedicated
Yeah,
ADD, ADHD is obesity.
which is nuts. That's crazy that that is the number 1 comorbidity. I had no idea.
Yeah, I
None.
didn't either. I didn't either. I was
Nope.
shocked. I was like, well, it makes a lot of sense.
It does make a lot of sense, because in the last 6 years that I've been in this community, a lot of us are ADHD.
Yep.
So number one comorbidity is obesity, doesn't that make so much sense on why so many of us are ADHD?
Right, and
Or
regain weight,
yeah,
right? And
yep,
and have it's like you know what to do with the eating, but that ADHD is another factor that
mhm,
interferes with the follow through that you intend to do. So,
100%. Yep.
can I share about your medication or not?
Oh, yeah,
For
I
the
don't care.
ADHD. Yeah, you go
Yeah,
ahead and tell.
so I just recently got put on Vyvanse.
Mhm. Great
I had
name.
to switch psychiatrists, and she was like, no, we're not gonna have you on this anymore. We're gonna put you on Vyvanse." And she said, 90% of my patients absolutely love it, and so if you don't, then we'll switch back, but let's try it. I'm always down to try something different. And so she put me on it, and I'm telling you, it's crazy amazing at, like, how I can focus in. Because before it would be like, "Oh, I gotta do this project, but I gotta do this, and I gotta do this, and I gotta do this, and I gotta do this." And it was all these other things swirling around it. And
Mhm.
now I'm able to say, "Okay, here's the project. What do I need to complete before I can complete this?" It's a very, like, I don't know, it's making me feel normal.
And as we spoke too,
Mhm.
Vyvanse is used for the treatment of binge eating disorder. And according to research, 50% of people who have bariatric surgery have binge eating disorder. I do not find that in my work.
Okay.
People, either they're not sharing that with me, but I certainly don't have a number anywhere near that high when I do the pre surgical evaluations. But either way, if you're listening to this podcast, it's really got to come as a relief to know that if you have ADHD and or binge eating disorder, there is help, and it is something that can be very much out of your control, but you
Mhm.
can make the choice to get the help for it. And Vyvanse is one great option.
Yeah, and the way she explained it was once you hit 50 milligrams, it's like, optimized for both ADHD and treating binge eating. I have a binge eating disorder, or, like, I've never been diagnosed, but girl, I can binge like the re and I've done that since I was a teenager,
Yeah.
and
Yeah.
I always was so ashamed of it, and I thought it was willpower, and I thought it was this and that, and I think I beat myself up so much,
Oh,
even
for
since
sure. And
about
that's
it.
heartbreaking. When you think about the
Yeah.
things that are, biological or out, outside of our control to some extent. I mean, we can get the treatment for it, but it's impacting us without our consent. And,
Mhm.
you don't know about it. And,
Yep.
and so you beat yourself up over it just to find out that, like, wow, a lot of this is nothing to do with willpower. And B, there is help.
There
So
is help.
compassion is such a critical factor in the recovering process from any disease.
Yeah, I think compassion for yourself, is very hard to find sometimes because
Yes,
we
it
are
is.
a critic,
Right.
and I think that has kind of my mission in the last year is
Good.
finding that compassion for myself, and also realizing that I'm not perfect by any means. I
Right.
do not do everything perfect as a bariatric patient, as, taking GLP-1s. I'm not perfect. But realizing that it's okay, and talking bad to myself, talking mean to myself is not okay.
It's not okay. And the other thing is to recognize, people think, well, I can't or whatever. You, I, all of us speak so
Mhm,
compassionately to other people.
mhm,
They mess up in the same way we do. And boy, we are all compassion. We
mhm,
have the ability, is the point that I'm making. And it
mhm.
becomes a choice whether I'm going to give that to myself or not. And I
Yep.
recall a day early in my recovery, not like the first week, but first several years, kind of like where you're at. It was like, I refuse to do this to myself anymore. I
Mhm,
am not badgering myself anymore. And it's a rare occasion when I do, because
mhm.
it is just one of the most damaging things,
Mhm.
and it's self-sabotage. Nobody's doing it to me.
Yep.
So I love where you're at with that, you
Thank
know,
you.
and coming to that conclusion, like, no, I'm not doing this to myself anymore.
Well, and I think, I'm in therapy, plus I'm in couples counseling with my boyfriend, and we I think I'm to a spot where I'm now uncovering trauma that happened in my old marriage, my ex-marriage, um, with my ex-husband and some abuse that happened there, and I am uncovering that, and I'm bringing it to light within my brain, and I'm realizing that, just because he spoke that way doesn't mean I get to speak to myself that way,
That's
and I
right.
think I've just been so used to it
Yep.
that it's just easy for me to just blame everything on myself, to repeatedly say sorry, to, blame myself for every little thing.
Right.
People pleaser, being not communicating, shutting down, all of these things that I do, and I'm now healing from that. And
Yes.
I'm now moving on from that.
Which is absolutely the focus of my podcast. Because if we continue that and
Mhm,
we behave like that toward ourselves, our external behavior and how we treat ourselves is going to be reflective of how we talk to ourselves. And the
mhm.
other thing I want to say before we move into the GLP part is that so many times people are like, I don't want to look at my past. I don't want to look at the past.
Mhm.
I'm not blaming it. No, it's not about blaming anybody. It's just saying,
Yeah.
because the truth is, our past affects how we perceive the present.
Oh,
And
100%.
if we don't work through those things, our filter is going to turn it into what you called a shit show. And
Yeah.
so, if we can work through that stuff, we can see the present much more clearly. We can respond more appropriately. We don't interpret through that negative filter what other
Mhm,
people are doing based on what the ex did, or the kid at school, or the teacher, or the parent. And so,
mhm,
it's not about going to the past to blame anybody or live there. It's to
mhm.
understand how that past affects our present. And if we sift through that, we have a much clearer picture of how to move forward.
Yeah,
So
I just had therapy this morning,
awesome.
and we actually worked through a few things that has been a big issue between me and my boyfriend for a
Hmm.
while, and we
Hmm.
worked through it, and I have a better understanding of why he does the things he does, but also a better understanding of why I do the things that I do. And we came up with kind of a game plan for when that happens, and then also, having us both agree, like, he needs to come over to my side, I need to come over to his side, so that we're double covered. So,
Absolutely. And
yeah,
I tell you,
it's very good.
just like you're explaining, and how many years are you into this relationship?
For
Okay. So you're like 6, 7 years into your recovery process, recovering from obesity, and
Yep.
4 years into this marriage. When my husband and I were married about 6 years, we did not have a good thing going on, and I was active in my addiction. And so
Uh,
around that same time, I went and got help through an outpatient treatment center like you got help for your obesity, the beginning process by getting
yep.
surgery. If it hadn't been for the aftercare,
Mhm.
meaning the individual therapy, the couples therapy, my husband being willing to do his therapy as well, there's no way. And
Yeah.
that is why the aftercare is so important, regardless of the method of weight loss, because
Mhm.
the issues are going to surface.
Oh, yeah, they will. They will. I mean, we got together is basically, right as I got divorced. And I didn't know any of the stuff that I know now. I was just like, yeah, happy to be free. Like, I'm divorced, blah, blah, blah. I was so much happier with Zach, but I also realized how much I was just stuffing down and not saying anything.
Mhm.
Same with him. And so
Mhm.
now that we're both in therapy and we
Yeah.
do couple therapy, and this is,
Yes.
and
I
I've been
love
going to
it.
my therapist for 3 years now.
Love that.
It's been a long process.
Yep.
It has taken me a long time to get to this spot that I'm in now. I don't wanna say ending because it's that would make me freak out and be like, "Oh, no, I'm done. I don't have to do therapy." No,
Yeah.
I don't need it.
Yeah.
But I think between, like you guys, like, I'm in therapy, I am in couples counseling, my boyfriend's in therapy, we talk about
Yep.
things, we communicate about things, like, we're finally in a spot where we feel good.
Yes, I love that. And, just like you were talking about your friend being an inspiration and doing, like so many people in the community look up to you. And
Mm,
I so respect and admire you sharing that because a lot of people are really reluctant to go to
mhm,
therapy. It's scary. You dig deep in it, it's like, oh, don't want to go there. But it changes so much.
mhm. For the better, in
Oh,
my opinion, and I think the people that do really well in this journey are the ones that immediately go into therapy. Like,
I
once
agree.
you decide you're getting surgery, you're in therapy.
I love it.
That
I
that's
agree.
what needs to happen,
I
because
agree.
I look at people and they're like, "Yeah, I'm 3 years post-op, and I've been going to surgery or going to therapy for 4 years," like, and they're doing very well, at least,
Yes.
what I can see.
Right. I mean, moving forward, right?
Yeah, yeah. So I really do think therapy is a very key point that a lot of
Right.
people don't realize how
So,
important it is.
in the treatment of a disease, and this
Mhm,
is a great segue into this, there are many modalities.
mhm,
So, with the disease of obesity, there's
mhm.
surgery, there are medications, there are weight loss medications, there are um, s- uh, fad diets, there are all the things. And there is therapy, which should be considered an equal modality because there's so much head stuff. But when you had bariatric surgery,
Mhm.
were GLP-1s even a thing that we heard about or talked about?
No, no, not at all. I remember, um, because when I had surgery, it was 6 years ago, so a lot has changed within that 6 years in the
Yeah.
bariatric community, the weight loss community. Um, and no, I think the only weight loss medications that I knew about was, Topamax, I think,
Mhm.
and, oh, what's the other one? There's one more that I knew
Phentermine? Was
about,
it
Phentermine.
phentermine?
Yep,
Mhm.
yep, and I hated the way Phentermine made
That's
me
what
feel.
most people tell me.
Mhm. I hated it. I was like,
Mm.
no," and that was before surgery.
Uh-huh. So you tried them.
Mhm. Yeah, I tried literally everything before I had
Mhm.
surgery. Like,
Yeah.
I'd been trying it my entire life. I had been on and off Weight Watchers, I had done fad diets, I had done, the army diet or the military diet. Uh,
Mhm.
I had told myself, like, I just need to stop eating,
Right.
um, and, "Oh, I'm gonna cut out all the sugar," so you go through all of your cabinets and throw out all the sugary things, and then it slowly makes its way back in.
Right.
Uh, I did everything, and
Right.
then when I saw a photo of myself at my sister's birthday party, and I did not recognize myself. I did not
Mhm.
know how I got that big, and
Mhm.
I decided I need to have surgery because my rheumatologist had mentioned it several times,
Okay.
but I didn't. I was like, "I'm not that big. I'm not
Mm.
that big. Like, I don't need
And
surgery."
you were so young.
Yeah, I mean, well, 33, because 'cause I'm
Oh,
39
well, pretty darn
now.
young.
So yeah, I think I really exhausted everything, and I think that's one thing that frustrates me the most,
Mm.
because I know somebody that battles their weight, and I have mentioned surgery, I have mentioned GLP-1s, and you know what they did?
No, I do not.
They bought GLP-1 patches
Oh,
off a TikTok shop.
oh. Okay, because I'm sure that's a real medically research
That's what
thing.
I said. I was like, pretty sure that's not a thing. Like, I'm pretty sure I would have heard about it at this point.
Yeah,
And they
you
said,
probably
"Well,
would
at
have.
least I'm doing something." And I said, "You know what? You
Yeah, you may be killing yourself by putting
we don't
something you don't know what's in your body.
well, a friend of theirs is doing it and has lost 7 pounds."
Okie doke, isn't that how it works? Yeah.
And it's like, I wish more people understood you don't have to exhaust every other option
Yes.
to have surgery or be on a GLP-1. You don't have to.
Right.
There is
And
no rule in the universe that says you must literally try every weight loss option before you can have surgery or be on a GLP-1. That's just not a thing.
I love that. And you know what's really fascinating about that? The all those other things
Mhm.
we all know. You do the keto diet, you will lose the weight and immediately regain the weight. You do Weight Watchers, and it can be very helpful if you
Yeah.
are able to stick to it. You
Mhm.
do phentermine, that is short term. Many people don't do well on it. You do any medically supervised weight loss diet, and unless you adhere to what you did to lose the weight, you will regain the weight.
Yep.
So, why don't we go with something that is very, very medically researched and
Mhm.
we know works if you combine it with
Mhm.
the behaviors? And if you struggle with those behaviors, you find out what the obstacles are, like the ADHD and the menopause and the whatever, and then you get whatever help you need for
Yeah.
those.
Yep. Yep.
So, wow, important message.
Huh.
We
I
need to,
think it is because I didn't know. I had no idea. I want to be able to talk more about that because you don't it's not a last resort.
no, it at all.
And as much as I appreciate TLC and showing the my 600-pound life and all of that, I think that also gave us a negative, like, headspace of saying, "I have to be 600 pounds,
Yes,
or it has to be in like, my last resort, because look
right.
at these people, this is their last chance. This is their" you know, I think it just gave us a different look onto bariatric surgery, onto weight loss surgery, onto, a lot of it, and I'm just like, that doesn't need to happen,
Yeah. Yes, you're
and
right.
I
And just for statistics' sake, the
Mhm,
International Federation for the Surgical Treatment of Obesity and Metabolic Disorders,
mhm,
what their recommendation is, and this was just this year or maybe the end of last year, they came out and said, first order of business with obesity is weight loss surgery.
mhm.
Second order of business is GLP-1s.
Yeah. I 100% agree with that, and since starting GLP-1s before anybody really knew what GLP-1s were, I have always said, surgery, GLP-1 working together.
Yeah.
That
And
is what is going to need to happen, and unfortunately, it's gone to where everybody's doing GLP-1s
yeah.
instead of using it in conjunction with
Mhm.
surgery.
So in my business, which is pre-surgical evaluations, 2024, like there were no patients. I'm like, what is happening? Everybody was
Mhm,
doing GLP-1s. And now the surgery is picking back up. And I would say 90% of the people who are having surgery have tried GLP-1s and either couldn't afford them, didn't have access, or their bodies didn't respond well to them.
mhm,
So not everybody's going to need surgery and GLPs or GLP-1s and no surgery or whatever. It's individual. But GLP-1s can be an amazing adjunct for some
mhm.
people. So, how did you learn about them? What helped you make your decision that this was a route you were going to take?
So my top weight was 265 when I had surgery. I lost 125 pounds. and it was, I was at 140, 150. It was crazy because I'd never imagined that I would get that small.
Mhm.
I was the person that was like, "Oh, it's not gonna work for me, but it's my last resort. It's my last option." So I did it, got really like, I just lost it. Within a year, I was at my goal weight, and then I continued to lose another 20 pounds.
Mhm.
When my ex-husband left me, my coping was once again eating because
Mhm.
I was living in the house that we bought together. I
Mm.
was living alone, because my asshole of an ex, sorry, I don't know if I
That's
can I
okay. You
okay,
can.
okay. Um, made my mom was living with us. He basically told her she could move in with us because there were some issues, and so we moved her in. And then once he left, he forced her to move out.
And now you're trying to pay for this?
Well, because he was like, "Well, if she's living there, then she can just pay the bills." Because he was an asshole. So, he even though he told her before he left, he said, "I will always take care of you and Kel."
Oh, wow.
Yep. And then when after
Wor
he
words
left,
and actions don't always match, do
yeah,
they?
yeah, I was like, "That changed quickly." So he forced her to leave, and so I was living alone for the first time in my entire life.
Wow.
And that
Wow.
is very scary, especially when you grew up with 4 sisters and a mom or 3 sisters and a mom.
And you're
Like, we
grieving,
were never
and
alone.
you're yeah, yeah, yeah.
Yeah. And, so I started eating, and it didn't matter what it was. It would have been crackers, it was popcorn. I don't even like popcorn, but it was in there, so I ate it. Um, and then I slowly started regaining.
Mhm.
And then I met me and Zach got together, and he is a huge foodie. Yes, he had surgery, but he's the world's worst bariatric patient, and he likes food. And he's a really good cook.
Mm,
So I stopped doing the things that I knew were good for me, like separating eating and drinking,
right.
and I started gaining a little quicker through that.
Mhm. Mhm.
When I was officially divorced, my now ex-husband decided to take my dogs.
Oh my gosh.
Yeah, and he told me, "You might as well say goodbye because 'cause you're never seeing them again."
Wow.
And the agreement was is that we would share custody of them. He did not
Mm.
want that because he had found a girlfriend a week after he left me,
Oh, wow.
whatever. So he took my dogs, and my dogs were like my saving grace. Through being bedridden, through having surgery, through the divorce process, being
Mm.
alone. They were always there for me, and so they were ripped away from me.
Wow.
And so I think I started gaining quicker
And
once that
interestingly, just to interrupt,
yeah,
people always say stress happened or life happened and I regained, to which I say well, cortisol can impact weight, but stress doesn't cause weight gain, eating does. But
mhm,
what people are saying is I've lacked the coping skills.
mhm,
And that's where you were before your therapy, left to the one coping skill that had worked for you for years with
yep,
all this trauma happening. So it
yep,
makes
and
sense.
yeah, it makes complete sense, right? I remember when I worked with Jamie, the sleep dietitian, and I said, "I don't understand why I keep going back to this coping skill." And she said, "Kelly, this coping skill has worked for you your entire life.
Yeah.
It makes sense that you would go back to that because it's safe and it's
Yes,
good for you."
absolutely. And I
And
need
once
people
I
to
realized
really
that,
hear that.
yeah, I was
And
like,
yes, that is so important. Instead of beating up on yourself, go, this is
"Mhm,
what I know. What am I going to do about it? Because I'm lacking other coping skills. I'm
mhm,
lacking healthy coping skills. So you're
mhm,
not a bad person. You're not, a loser. You're not a failure. You're lacking something that you haven't learned. That's why you go
Exactly.
learn the coping skills. Carry
Yep.
on. So now you're regaining, you got all this trauma, divorce, now the dogs are gone, you're living alone.
Yep. So I ended up me and Jamie, the sleep dietitian, we have become really good friends. Like we're basically the same person.
Mhm,
Um, I the first time I hung out with her, no, it was the second time, but it was the first time just the two of us. We went to Disney together.
mhm.
And we were in line of the Avatar ride, and we were talking, and she said, "Well, I'm on a GLP-1."
Ah,
And I said, "Well, what's a GLP-1?" Because we were sharing like it was like a granola thing. And she was like, "I'm done with it if you want to have the rest." And I was like, "Are you sure?" And she's like, "Yeah, I can't like I know when to stop myself now." And I was like,
right.
and so like,
What
I
is
was like,
that?
that is a foreign concept for me because I always push past. I'm like, "I know it should sound
Right.
good. It's really good." And so she told me all about it in the line in Disney at Avatar, and I go, "I really need to look into that.
Mhm.
I really do." And so this was September. November was the very first Just Be You Bariatric Awards,
Okay.
and I had put it off. I was just kinda like, "It's fine, I'll deal with it after this." By the time I think it was December, it was the no, it was right after JBY. I got a prescription. I got signed up with Sequence, I think was it what it was
Yes.
then.
Yes.
And I got my prescription. I found it. I paid $20 to $5 because that was when they were doing the coupon. And I started it, and then me and Zach left for Mexico, and we spent a week there, and I remember being shocked at how much I did not think about food,
Wow.
and how I could look at like because they had a buffet at our
Yeah,
resort, and I was like, I don't need any of that." And I went straight for like the meat and the fiber and the like the things that I knew were good for me.
right.
And this is at 2.5 milligrams. This is the lowest dose they
Right.
go. And I was shocked. I was just like, is this real life? Because I've never felt like this
So
in
this
my
is the
entire life.
second time you've basically said, "Is this how normal people feel?"
Mhm.
Meaning your brain and the Vyvanse and like, wow. And
Yeah.
then the GLP-1 and the brain thing again, wow.
Yeah.
So there are
Yeah.
medications to help the things that can it's not all psychological stuff. There's a lot of psychological stuff that are, that get in the way, but there's also the reality of some of this biological stuff.
Yeah.
So, okay, carry
Exactly.
on. So you're like, wow.
So I was floored. I was just like, this is fantastic. And of course, I could not weigh myself the week we were gone because there were no scales. And, but I remember losing weight very quickly. And so I was like, well, if 2.5 does this, I'm going to take more. And so every month they would up it. So I went 2.5, 5, 7.5, 10. I went all the way up to 17
What? I've never heard of that.
or 15, 15. I think it's
Okay.
15 is and
No side effects?
I was like, "Nope, never had any side effects except for the fact," and this is what my downfall was, I didn't eat.
I was going to
I
ask
ate
you,
the bare minimum.
why did you keep increasing the dose if it was working at a lower dose?
So I think back then I was so desperate because and I'm gonna be completely honest, being on the podcast, being in, you know, a well-known figure within the bariatric community,
Right.
I was embarrassed
Oh,
that I had regained. I did not talk about it for the longest time. I kept it to myself. Like everybody couldn't see that I had gained weight. Like, you know,
yeah.
I didn't want to talk about it because I was like, what kind of authority do I have if I'm sitting here preaching, eat your therapy, do all this, do all this, do all this, and I've regained 60 pounds.
Mhm.
So I think I was at a point where I was just like, I don't give a shit. Get this weight off my body. This
Right.
is embarrassing.
I got it.
And so and it was hard because on the sequence, like they would just ask you, do you want to go up in dose?
Wow. There
And
was no medical doctor involved here?
well, they were, but they were messaging you.
Oh boy.
And it would ask you, do you want to go up on your dose or do you want to stay where you are? Well, it's working on 2.5. Let's jump that on up. And with no side effects except
Right.
not eating.
Right.
It why not? I knew there was no information out there.
And it
There
was
was
still not
nothing saying,
costing you a fortune? It was not costing you a fortune?
nope, I paid $25 a month
Wow.
because they had the
Wow.
coupon good for a year. And
Okay.
so I lost all the weight. I lost 50 pounds, which I didn't
Did
want to lose more than that.
how were your blood tests? Your
That's a good question.
nutritional
I
levels?
didn't do
Okay. I'd be curious since you really weren't
that.
eating.
Yeah, no, all I had were butter toffee cashews, and I would eat maybe half of one meal a day.
Okay, not bariatric prescribed at all.
And guess what else I didn't talk about? The fact that I was doing that. I didn't talk
Right.
about it because I knew it was wrong.
Right.
And I just didn't eat. There were times that, like, when it started to wear off, I could eat a little bit more. But for the
Right.
most part, nope. As long as I lose the weight, I don't give a shit what I did. I
A
was
medically induced eating disorder, I'm going to call that.
Ooh, yes, that's exactly what it is. And one of the big side effects from me doing that was I lost a lot of hair.
I'll bet.
I was My hair was about this long,
Mm,
and nobody could tell because I wore a beanie, or two, I have hair extensions. It covered
yeah.
it up. But I lost so much hair. It was embarrassing again.
Yeah.
And and at this point, my coupon ran out on my Zepbound or on it, but back then it was Monjaro,
Right.
and couldn't find it anywhere, even
Mm,
if I could purchase it.
mm.
So I was forced to not take it anymore.
Were you panicking?
Oh, I would panic daily
I'll bet.
because then I found myself eating again and coping again. And
Yes.
all of those things that I thought I ran from
Right.
were back.
Oh gosh.
And that was from
That's a hard reality.
yeah, it was very difficult. And then to be like, I wore this a year ago and I can't fit into it now.
Oh, I love your vulnerability. Thank you for being so honest about this.
Yeah, no problem. I mean, that's one of the biggest things that I've come to grips with is it was my fault. It was my fault. I just wanted it to be a miracle.
Right. Right.
That,
As
that
yeah.
I just push that button and it fixes all my problems. And it did for a while.
Right.
It did for a while. But then the moment of
It
there was
didn't. It covered them.
that's a good point. That's a good point. It did. It covered it. And I thought it was like this miracle. And I was just like, I was happy and I was thin again. And I was like, but I will tell you, it didn't change my brain.
Mm.
I still did not talk nice to myself. I
Oh.
looked at myself in photos and I still tore myself apart. I was like, "Oh, your legs are still fat. You've got cottage
Mm.
cheese legs. Oh, you can see your double chin there, or there's flab on your arm." Or
Mm.
I did not speak nicely to myself, even being the weight that I wanted to be.
Right.
And then everything dried up. It was a shortage all over the country. There was no GLP-1 available.
Mhm.
And
Right.
so when I started gaining, the self-talk got worse and worse and worse.
Oh,
And I started saying, you just need to stop eating again. You just need to cut out all carbs, even though,
diet mentality.
uh-huh. And I'm not a stupid woman. I
Right.
have, at that point, I was still on the podcast. I
Right.
talked to probably hundreds of experts at this point.
Right.
I knew what I was doing, but I
Yes.
didn't care because
Right.
I didn't want to be embarrassed about my body anymore.
Right.
And when
It's
I
powerful.
it was honestly like I look at that time and I'm just like, I wish somebody had pulled me aside, especially being connected to a platform where they're supposed to care for you
Mhm.
and they're supposed to be asked questions before they prescribe. There was none of that.
Wow.
Questions they asked were, "Do you have high blood pressure? Are you pregnant or thinking about being pregnant?" And then there was one other one. No, no, no. Cool.
Wow.
There was no person saying, "We need to have an appointment and discuss what's happening."
Right. That
And
is
that I
tragic.
I know. And there's still platforms like that today.
Oh, I know.
They don't care. They're
Come
like, "Give us our monthly money
Yep, 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 yep.
prescription for you."
Well,
And I have been very hesitant to even work with another company that does that.
dare I say there are many bariatric surgeons and bariatric programs who are the same way.
Mhm.
I'll talk to them. The surgeon I worked with for 15 years literally would say, I have no value for what you have to offer in this field. Give me your
That's
money, let me do the surgery.
that is scary.
I know, but it's the same exact thing.
It's
It's
like
it's a
just pay.
whole package.
Yep.
Multidisciplinary team. Everybody promotes that in their advertising, but it's not a reality everywhere.
No. I would love for someone to actually give a shit about us
Yeah.
when it comes to a GLP-1.
Absolutely. And maybe that will happen because when
Mhm,
I started in the bariatric community, which was 20 years ago, I was
mhm,
a loner. I was a loner talking about we need aftercare. You don't understand.
mhm.
So many of these patients don't understand they don't have other coping skills and they are going to need them because life continues to happen. I
Yep.
knew because I went through it in a different arena,
Yeah.
personally and professionally. And that's why I have been in aftercare for over 20 years. And
Yeah.
so it took the bariatric community
Mhm,
probably 12 to 15. So it's only been in the last 5 to 7 years that I have seen an influx of professionals in my field
mhm.
focusing more on the head component.
Yeah.
And so maybe that will happen with the GLPs.
Mhm.
We'll see. But you are so valid in your point that it needs to be a component.
Well, and I think so and then, once I had my world had kinda crashed and imploded on itself because of the, lack of, like, GLP-1s, I had started doing a compounded version. Compounded versions don't work on me. Like,
Oh,
I don't know
really?
what it is, but I tried both the Ozempic side and the tirzepatide. Neither of them worked.
Really?
Yep. So through the podcast, we got an offer to work with another company, kind of like Sequence, and they would give us our prescription. So I was like, well, it doesn't hurt. So I started taking it again. And I will say I did it a lot different
Good.
this. I was very aware of I need protein, I need
Good for
water,
you.
I need to be moving my body. That's the key component that is so hard for me. But I really thought and believed in my head when I said it, I didn't care how slow I lost the weight.
Good.
If I
Good.
lost 1 pound a month, we're moving in a direction. But I did not want,
Good.
after 2 times after bariatric surgery and the first time on a GLP-1, losing the weight so rapidly because I wasn't eating up to what I was supposed to.
Right.
I wanted to do this time different.
Beautiful.
So I'm at a spot where, yes, I have gained some more since I, you know, had my second bout of regain. I am slowly working on, through therapy. I'm working with Jamie again with the sleep dietitian. I'm doing her bariatric breakthrough program, which I can't say enough good things about her. She
Mhm.
really understands what's going on in
Right.
your mind without ever being in your mind. I don't know.
Mhm.
And I may be biased because she's my twin, but I I've worked with her twice now, and
Right.
I paid for one-on-one services with her because I believe in how she treats
Right.
her clients.
And
And
you're
the
paying
bariatric.
for therapy. And
Yep.
you're paying you have to do what you need to do. People
Mhm.
need to get the help that they need to get.
Mm. Yep. Yep, and I
So,
think because of her dietitian skills, her having surgery, all of these things, it really helps get your brain back into, "Oh, I'm not trying to eat as little as possible.
right.
Trying to eat normal meals
And be healthy.
and be healthy." And then the weight loss follows because your body's not holding on to that because you're not eating.
Right.
It's a
Right.
whole thing. And I think I've learned a lot since first hearing about a GLP-1. I've learned what not to do.
Right.
I learned that I really love my hair and I don't ever wanna lose it again.
You like your
And
mental
I'm
health too, I'm sure.
It's helped my mental health. I'm working, my newer thought process along with therapy is, I'm going to love my body where it's at, not where it could be, not where I wanna
Mm,
be. I'm gonna love it where it's at.
I love
Do I
that.
have big thighs? Yes. Do I have a jiggly stomach? 100%. Do I have fat rolls? Yes. But I'm gonna love my body the way it is right now
Mhm.
because what am I waiting for?
Yeah, let me just slide 2 things in because it just so reminded me. Tabitha Johnson, who is the marriage and licensed marriage and family therapist who's part of bariatric care and
Mhm.
also a post-op herself and does bariatric coaching. She and I
Yep.
were talking this weekend, and we were talking about body acceptance versus body appreciation. And I think it's really hard for any of us. I've
Mhm.
struggled with body image issues since I was 14. I remember the moment it started, and it's been a battle ever since. Sometimes it's worse than others. But
Mhm.
I like the term body appreciation.
Mhm.
I
I do too.
appreciate that I'm able to do this or do that or have the hugs or, you know, do take care of my own house and body appreciation. I'm never going to be like, "Woohoo, look at the cellulite." It's not gonna happen. So I'm not
Yep.
gonna try to love my cellulite. I'm gonna
Mm.
try to accept it, and I'm gonna try to appreciate that the legs where the cellulite live get me out fishing with my grandbabies and take me
Yep.
to Disney World every day in 2 months. And because
I so
I have the pass this year. And
I
the
would too if I lived that close. Just
and the
saying.
other thing is, um, I had a retreat recently, and it was so magical. And I
Mm.
remember saying to the group, and we were talking about when does it end? When does it
Mhm.
end? I am no longer in my 30s or 40s or 50s. And the battles we were talking about, when does it end? And
Mhm.
I said, the conclusion that I have come to is when I say it does.
Huh.
It ends when I say it does. And sometimes I have to say it 5 times a day.
Yeah.
It ends now because you start it over again.
Yep.
When does it end? Right freaking now.
Yep. Yep.
So I just wanted to slide those things in there as you were talking about. So are you currently on a GLP-1?
Okay, so I have kind of stopped taking it.
Mhm.
Number 1, it's out of my budget.
Mhm.
Um, I am, a new business owner. I'm still trying to build up my clientele and trying to do all the things. So it's out of my budget right now. Like I can't pay $500 for
Right.
Zepbound.
Right.
Um, I'm working towards being able to afford it because I know my body does better on it.
Mhm.
Uh, but I also want to learn how, not that I have to do it on my own, but I really want to go through this period of time where I'm not feeling embarrassed about my regain. I'm not
Mhm.
feeling like I need to get this weight off right now because I'm a
Right.
pillar of the community and I don't want to, like, I don't want people looking at me like, what the fuck does she know? Like,
Yeah.
I
Yeah.
want to love my body where it's at. I want
Right.
to buy clothes that fit my body now, not
Mhm.
anywhere other than right now. And
Yes.
like, you I want to be in a different mindset right
I love
now.
that. I
And
love
even
that.
if it takes me years, I would
Mhm.
much rather be in the mindset of I'm doing everything I can
That's right. That's right.
without completely leaning on something else. I know in the past what I've done, and
You're right.
I wanna see what I can do when I actually sit,
Yes.
try, and do the things.
And I think that regardless of all of all of the things, the lifestyle has to be consistent over the
Mhm.
long haul. Yeah, there
Yeah.
are going to be ebbs and flows for sure. It's not
Mhm.
going to be consistent perfection, but it's
Yep.
going to be consistent-ish, right? The healthy lifestyles have to be part of
Mhm.
whatever other modalities a
Yeah.
person is using. And
Yep.
so working on that lifestyle consistency and then
Mhm.
utilizing the Vyvanse and utilizing the back on track program and utilizing the GLP-1 and utilizing, whatever kinds of resources assist, but you got to know you're doing what you can do
Mhm.
because it has to be done with GLPs or without them, with weight loss surgery or without them. It's a lifestyle.
Yep.
And
And
that's
I
the
think that's
core.
where I'm at now, is I need to learn how to do this as a lifestyle, and I
Mhm.
feel like once I get a handle on that, then I can
Right,
start with GLP-1 because then it would be working in conjunction like you had talked
right,
about at the beginning.
right.
But right now, I don't think being on a GLP-1 is a good idea for me. I
I
think it's
love
a
that.
I think it's a crutch for me instead of really saying, what are the root issues that I have going on right now? I love you too.
Seriously, this is such an important message because it sounds like the first time you did them, it was like the magic pill that everybody's looking for, the surgery, the magic pill, the GLP-1, the magic pill. Those are all assists, and that's why we call it a tool. They're assists, they're tools, but the
Yep,
consistency is in lifestyle. And I love that you're like, I need to have this lifestyle down. And then
yeah.
if I have that as an adjunct, it's not a magic pill to me in my mind. So,
I
what
think
a great,
honestly,
healthy
so
mindset.
yeah, and I think I'm really, like, on this because I have 2 vials of Zepbound in my fridge
Hmm.
I haven't taken because I really feel like it's just not beneficial for me right now in this moment in time. And you know, I'm not white knuckling it. I'm not
No,
like, saying I'll only use it as a last resort. No, I'm saying let's figure out what's going on with me. Let's learn to
Right.
love the body that I'm at right now.
And let's
Let's
learn
learn.
to implement the coping skills, and let's learn to talk through the issues, and let's learn to set the boundaries, and let's learn to have good self-talk. All the things that make for a healthy lifestyle beyond bariatrics.
And a consistent routine.
Yes, for
That's a big
sure.
one for me, and I've been working on that for months now, is trying to come up with a consistent routine
Yay.
where I don't even have to think about it. I just do it
Yeah.
and
It's what I do.
incorporate all those healthy things.
Yep. Yep.
So I think it's working well. I don't know, we'll see. I'm sharing everything right now because it's just I am realizing how much people feel like a failure
Yeah.
after regain. I mean, I
Mhm.
felt like that too, but for some reason thought I was alone in that
Right.
thought. And after I posted that post about how many months does it take you to lose the weight, I had a lot of people comment on that said, thank you for posting this because I just feel like I'm a failure right now. I've
Right.
regained and I don't know what to do. And it's like it the journey never stops.
Yeah.
It
That's
stops
right.
when
That's
you're on.
right. That's so true. And
So,
that's all of it. The weight, the
yep,
improvement of relationships, the improvement of self-talk, the improvement of mental health, all of it. It's a lifelong journey.
yep, yep. It'll
And
stop when you're dead.
I got to tell you, from where I sit, and
Mhm,
which is an outside perspective, and listening to you,
mhm.
you sound like you are in such a good place. And I
Thanks.
appreciate more than I can tell you the real story you just shared. And
Thank you.
I can't imagine how many people that is going to help. And that's why I changed the name of the podcast from Bari Aftercare, because people think Bari Aftercare or bariatric surgery.
Mhm,
Bariatric means the study of the science of obesity. But
mhm,
two, weight loss information. We want people to win at this. It's a nasty disease, and it's so
mhm.
self. People are so hard on themselves about it. So I know you have a ton of followers, and I know you will share this episode
Of
because
course I will.
GLP-1s are on the scene and they're not going anywhere. But I love that you shared they're not the magic pill any more than surgery is or anything else.
Nope.
It can be a wonderful adjunct for some
Mhm.
people.
Yep, and I'm not
So,
saying that GLP-1s are bad by any means. I
no,
feel like they have their time and place. I feel like they do
absolutely.
a wonderful job at shutting off that food noise,
Right.
helping you make healthier decisions. But I also think they have their time and their place. And I
Mhm.
also think doing it through somewhere where you can be monitored
Yes.
and they're not just saying, "Oh, up a dose, up a dose, up a dose, up a dose." Like, no.
Mhm.
Like, I stayed at 5 milligrams for, like, since I got back on it
Oh, good for you.
because
Good
I was
for
like,
you.
"There's no reason to go up to 5:15.
Right.
5 is doing the job. So
Yeah.
why? What's the
So
point?"
work with a medical provider who sees the value of not just the medical part, but where are you at in your head with this?
Correct.
So
Correct.
as we wrap up,
Yes.
share like your 2 or 3 highlights, and then I want you to tell everybody about your business again
2 or 3 highlights of the show?
today. Mhm.
I think really voicing my entire being completely honest. I think that, it's the first time I've really done that, and I
Well
feel
done.
really good about it.
I do
I feel
too.
like it needs to be talked about, and it's a reality of mine. That's what happened. That's my life, and
Right.
I think just being able to be there and help people and maybe help them not feel alone, I think that's like, those are just the highlights of, you know, sharing my story, and
Thank
I
you.
honestly haven't recorded anything since, like, March, so this is kind
Wow.
of
Thank
"Oh,
you.
this feels familiar."
Well, as always, you are well spoken, articulate, and very, very intelligent and so real. So real. Appreciate it.
Thank you. I appreciate it.
Okay. Your new business and where people can find you.
Okay, so I'm Barry branded. On Instagram, it's Barry.branded. And that is I help people brand themselves. I can build a website, I can create social media, I can be a social media manager. I can pretty much do anything you need. I can build graphics, I can build you a brand guide, whatever you need, I can help you build it so that you can show your brand off and that I just think it's fun to brand yourself and pick out colors
Mhm.
and do all that. But it can also be very overwhelming if you don't know what you're
Mhm.
doing. So
Sure.
that's where I come in
Yes.
is
Yes.
I make it to where it's not scary and you just say, this is what I'm wanting. I create it. There you go.
I love
So
it.
yeah, it's a lot of fun. I also do virtual assisting. So for companies that need somebody on the back end to take care of emails or scheduling or whatever needs to happen, I'm there and I can do that. I'm just loving still working in this field, but just in a different way.
I love that you're doing it too.
Thank you.
All right. So I will post all of your contact information in the show notes. And thanks again for being in this. And I look forward to doing some work with you, which we've already discussed. So more coming about that, friends. All
All
right.
right.
Have a great day. And I'll let you know when this is going to drop. And
Okay.
love you much.
Love you too. Bye.
Bye.